Welcome to Job Ready Executive Roundtable Houston Edition. I'm your host, Jeff Nelder. You're joining the latest in our Job Ready series of regional roundtables, where we convene employers, post-secondary, and workforce leaders in conversations about local education to employment issues with national workforce implications. Today, we'll dig into Houston's healthcare workforce challenges, as the need here has never been greater, and the people and brands working to solve it are among the best in the world. The numbers are stark. Texas faces a projected shortage of over 27,000 registered nurses this year, with estimates reaching approximately 57,000 RNs by 2032. And significant shortages exist across so much of allied healthcare as well, in roles such as medical assistants, radiology, pharmacy, surgical techs, and behavioral health. We're grateful to hold today's conversation with leaders in Houston, home to Texas Medical Center, the world's largest medical complex, comprising 61 institutions and serving over 10 million patients annually, hosting globally recognized institutions like the MD Anderson Cancer Center and Harris Health System, as well as partnering with Houston City College, Houston's own post-secondary workforce development powerhouse. As a healthcare workforce partner, Houston City College serves 85,000 students annually and partners with Texas Medical Center institutions to fill critical healthcare vacancies in high-demand roles. I am so grateful to be joined by leaders from all three of these institutions today. Let's welcome these experts to Job Ready Executive Roundtable. We'll start with Dr. Christina Robinson, who is the Executive Director of Work-Based Learning and Industry Partnerships, Talent Solutions, and Community Learning at Houston City College. Dr. Robinson brings extensive expertise in developing innovative partnerships between educational institutions and healthcare employers, with a proven track record of creating work-based learning programs that address critical workforce shortages. Welcome, Christina.
Nice to see you, Jeff. Thank you.
Always my pleasure. Next, Dr. Miranda Phillips, who serves as Program Director of Workforce Education, Education Development, and Innovation at MD Anderson Cancer Center. Dr. Phillips specializes in designing and implementing workforce education programs that respond to rapidly evolving industry needs, with particular expertise in healthcare workforce development and innovative training models. Welcome, Miranda.
Thank you. It's great to be here, Jeff.
So glad you're here. Finally, Jobi Martinez serves as Vice President for Workforce and Community Connections for Harris Health System, with over 25 years of experience in leading inclusion and access initiatives across education, employment, and healthcare. Dr. Martinez brings a unique perspective on creating accessible pathways to healthcare careers and advancing workforce development through community partnerships. Welcome, Jobi.
Thank you for having me. I'm excited to be here.
I am so excited to hold this conversation, empowering the benefit of the experience and knowledge convened around our table today. For our audience, we'll be using our regular roundtable format. 2 segments. Segment 1, we explore the current state of the healthcare workforce and examine existing collaborative efforts. Segment 2, we dig into actionable ideas from our experts that so many of you in our audience will be considering for your own workforce across the nation. So let's dive into segment 1. Christina, let's start with you. In your role leading work-based learning and industry partnerships at Houston City College, would you please ground our audience by painting a picture of the current landscape? What are the most critical shortage areas you're seeing? And how are these manifesting in the partnerships you're building with healthcare employers?
Absolutely. Once again, thank you for being here. So over the last year, the Gulf Coast region has filled 14,400 allied health roles. That's everything from nursing and direct patient care, as well as your allied health and technical specialties. You touched on this in your introduction, but massive shortage in RNs and LVNs, specifically. We've got retirements, we've got COVID burnout, and so many other things that are happening. And more importantly, just significant challenges in retaining staff. And that's all roles, not just your lower level CNA roles. That goes all the way up. So hospital systems are increasingly asking us, how can we build stackable programs all the way from a CNA and up in order to make sure that they can not just hire individuals directly from a lower level to a higher level, but really build them a long-term pathway due to this attrition. And so the other piece of this is more and more hospitals are looking at apprenticeship opportunities. Why? Because when they look at clinical placements and how they're going to place people, we know that apprentices tend to have a higher percentage of retention. So this whole earn while you learn model, in the past, we used to not pay individuals for their clinical placements. Now they have an opportunity to get paid while they're going through this process. So everything from sign-on bonuses, tuition reimbursement, you name it, huge change on that. And lastly, with regards to shortage, we also are hearing a lot more on your higher level positions. So your rad tech positions, you mentioned sterile processing techs. So employers are saying, hey, we'd really like students to have more experience, maybe 3 to 5 years experience. Well, how are they going to get that experience, right? They've got to be on the job, doing the job in order to do that. So our biggest change, I think, is we're seeing shorter training programs, lower hours, so we can get those people into jobs, get them learning and training with mentors, so that they can get placed into these roles and hospitals can be more successful in the long term.
Wow. Well, thanks, Christina. That was a terrific overview of the current landscape and how the shortage is manifesting in the partnerships that you're building with healthcare employers. Miranda, I'd like to come over to you and say, in your role in workforce education and innovation, you're in a unique position to see how traditional education models need to evolve. From your perspective, what are the biggest opportunities for improvement between how healthcare workers have been prepared traditionally and what today's healthcare shortage and environment requires?
That's a great question, Jeff. And I know that Christina hit on this a little bit in her response. So I'm going to emphasize that because I think these partnerships are critical. I know that traditionally, you post a job and you catch who you can catch, but I think that starting these partnerships early, whether it's through apprenticeship models, externships, internships, being able to tap into these programs and have relationships with these different programs, especially for a lot of these frontline entry level to healthcare positions, such as like she mentioned, CNAs, phlebotomists, some of these, a lot of the technician roles, being able to catch them while they're in their program, meet with it and pull some of them into apprenticeship programs or form those relationships early. I, and I know we'll probably talk about this more throughout, but it's a barrier to schedule those clinicals that are required for a lot of these roles. And these people are working. A lot of them have other jobs. They have families. So to fit clinicals in and around all these other things, sometimes that's a role that is an obstacle that's insurmountable. When you have an earn while you learn scenario, such as with apprenticeship, you are creating opportunities for them to make money while they're finishing up their educational programs, getting on the job training. And for us, if they're in those programs and they're receiving that training, they're doing it the way we want them to do it. Like they're learning that, every hospital has their own way of doing things. So we're kind of building our workforce and that we are not retraining them for the ways that you want them to do it when they get here.
That makes a lot of sense, Miranda. So apprenticeships can't be one size fits all. And the power of apprenticeships, it sounds like, is in the actual workplace learning and the specifics of that particular workplace, right?
Absolutely.
Okay, so we've heard about what today's healthcare shortage and environment requires. I'd like to go to you, Jobi. Harris Health serves a unique role in Houston's healthcare ecosystem, especially in reaching underserved populations. From your perspective at the intersection of workforce and community connections, what are the specific barriers that prevent people in underserved communities from accessing healthcare career pathways? And how does Harris Healthcare create more inclusive entry points into the healthcare workforce?
So, one of the greatest barriers to underserved communities or vulnerable communities like those that we see in our patient care is the lack of information. Oftentimes, when we think about pathways to healthcare in terms of careers, we think about a nurse and a physician. because that's all we're often exposed to. And sometimes, in our K through 12 system or even post graduate school, we mainly just hear those careers because they're the most attractive ones. We don't hear about the data collection. We don't hear about security. We don't hear about catering, bistros. I'm going to brag on our system. We have some really amazing chefs that are part of our bistros. And so there are a lot of really great careers, marketing, media, AI careers that we're helping sort of shape today as well in the healthcare system. So a lot of great careers, but a lot of people don't know about them. And simply because they lack that information, they lack the exposure. And so some of the things that we try to do are advance our volunteer services program. So through our volunteer services, we work with junior high school students, just expose them to the different career opportunities there are. We have internships, fellowships, and really we try to create those pathways of exposure so that they can learn more about other careers. They can learn maybe what an entry point looks like if nursing or a physician, if there's just not quite that pathway for them there, whether that's educational access or financial access, they can find other ways because organizations like ours too, we have programs like internal mobility, we have tuition reimbursement, we have lots of great pathways that they can choose from once they decide what that entry point is going to look like. And for many, that's guest transportation. Guest transportation, I think, is one of our most unique career paths because you get to see every corner of a hospital or every corner of our clinic. And so you do have the exposure to understanding the process of healthcare, but also looking at different roles within the healthcare system. And so, again, part of that is advancing the information. What is in our system in terms of careers, how to get there. That's our main role and function. We are an academic mission institution because we are tied with Baylor Health and UT Health, but we're also partnering with many great high schools, many great community organizations to just talk about what a career at Harris Health looks like.
Christina, let's come back to you in this case. Work-based learning seems to be a crucial component, right? It's critical. If there's any sustainable workforce development initiatives, workplace has to be involved. How are you and your colleagues at Houston City College structuring these programs to benefit both students and employers? And what does the most effective work-based learning pathway look like in healthcare?
Sure. Well, about 2 years ago, the Texas Workforce Commission said they really wanted to have colleges launch pre-apprenticeship opportunities. And specifically, they were redirecting funding to really create these bridge programs, how we like to think of them. You've got a pre-apprenticeship, which is going to be less than 6 months. And then you move to an apprenticeship, which could be a year, 2 years, all the way up to 5 years. So with that being said, I believe the entire region really said, hey, what is this going to look like? And so now we see students, we're bringing them in, we're putting them through an initial pre-apprenticeship, less than 12 weeks, so they can really learn some basic skills and quite honestly determine, is healthcare right for me? Because there's so many roles in healthcare, from patient transport to rad tech. So they might not be that person that's going to be in the ER, but they might be the person that's going to transport somebody, right? So I think students today, they don't know all the opportunities that are out there. So we're really being able to now transition on saying, hey, go take this role, take this job. You don't have to be a nurse, but we want to expose you to a wide variety of opportunities through this pre-apprenticeship pathway. And then they roll into a full apprenticeship upon completion of that and selection by the employer. So I think that's really a big structure. In addition to that, we have specific competencies that individuals need to learn while they're on the job. And so, most hospitals, you're going to have a preceptor that's going to be testing them and seeing how successful they are on their clinicals, while they also have a mentor. So we're taking it a step further. They're having 90-day evaluations, and we're sending someone in there to assist with that effort. So that way it's taking a little bit off of that leadership team that they have to do it all, right? And so as Miranda mentioned, they're learning while they're also training. And so they get exposed to a lot of things. I know recently a student was like, I'm terrified to give medicine, right? And this is something that they have to learn and and feel comfortable with. So that's a conversation that they might have with their mentor or their faculty member, and we can role play and see, what does that conversation look like? What do I need to think about when I'm handling a patient more effectively? So really structuring those opportunities to have those students literally try before they commit, so to speak, because that's going to be a much better employee and a more long-term employee.
Oh, that makes a lot of sense, Christina. So it's not just the apprenticeships, it's the pre-apprenticeships. It's not just the job ready skills and knowledge, but it's also the personal preparedness, right? We hear about so much burnout in healthcare. You got to be ready. Makes perfect sense. Miranda, I want to come over to you from an innovation standpoint. How are you adapting workforce education to address both the immediate crisis and long-term sustainability in terms of new models or approaches you're piloting at MD Anderson?
So for us, one of the most important things is to look at where we have a lot of turnover, look at where we have a lot of vacancies, because that's where the focus needs to be. So a couple of years ago, we started with Christina and her team establishing apprenticeship pathways, and we started with phlebotomy, CNA, PCT, patient care tech roles. And this has been very, very successful. In fact, we've had a lot of movement with patient care techs, and the retention is much better right now, as well as with phlebotomy. So that it has moved to other areas throughout the hospital. We have a mammography program now. We're starting sonography in the spring for apprenticeship pathways, but it is garnering enough attention with the successfulness that we're looking at moving to the other areas of the hospital as well. We're talking about moving into facilities and maybe adding some facility roles. Christina mentioned patient care, patient escort. That is a new pathway that we're looking at adding because these are areas where there's high turnover. And one of the great things about apprenticeship is that we are able to offer more wraparound supports to remove barriers and obstacles for a lot of these entry level positions come with. So a lot of our techs, they might have problems with childcare. They might have problems with transportation. So there's programs in our city, like through Workforce Solutions, through the WIOA grant funding, that we're able to connect them with and provide even more support so they get through the initial difficult part of assimilation to a new job, to a new career. Because once they're really grounded, and after their apprenticeship year, we keep almost all of them. The retention is really good. I know Christina mentioned that, but for the apprenticeship programs, the retention is really good, and that's more than half the battle, because by then they're assimilated, they understand the culture of MD Anderson, they're more likely to stay with the company at that point. And we also have we also have several education programs, like short-term education programs. We have a short-term endoscopy program. It's a 12-week program that we developed so that we could quickly train employees in-house. We've had internal employees that wanted to upskill that have gone through that. And right now we're at 100% for endoscopy techs. Like we are completely filled. There are no openings for that. And that's the goal, to get filled and stay filled. So and they're trained in the MD Anderson way when they're trained that way. But that is also part of a partnership with HCC, so they can finish our program. And if they want further education, they can continue to upskill by getting PLA credit and moving on to HCC to finish their programs. We've got several programs in the works like that. As we see a need, we can develop short-term training and help address our needs in-house.
Okay, we've heard about longer term approaches in creating sustainable healthcare workforce development models. Jobi, coming back to you, how can we ensure that innovative funding models for wraparound services and new career pathways reach the communities that need them most? And In your unique perspective, what role do community partnerships play in making healthcare workforce development truly inclusive and accessible?
So community partnerships are pivotal, especially in this time as we continue to face some challenges with funding. We do serve vulnerable populations, and funding is a major barrier sometimes for us as a system. And so we do rely on community partnerships. We have some really great community alliances that help us identify gaps and opportunities. They help us also better serve our patients. But in terms of our workforce development, again, we have great community alliances where we let them know what a career at Harris Health looks like, what a pathway looks like. And again, it's those building those partnerships with schools and helping them understand this is how you get to Harris Health. It doesn't matter if you're not choosing a nursing track or a physician track. It is just this is great employment opportunity. It's a great way to give back to your family, give back to yourself, give back to your community as well. So part of that, yes, we do rely on some strategic collaborations with communities, and communities understand the role that we play within Harris County. They know that access to a hospital or a clinic, if we were not around, they would have to drive miles, or that they would have to really, unfortunately, be in burden situations if we weren't part of that community. Because so we do have 2 hospitals, but we also have 30 clinics throughout Harris County. And just having our voice, having our presence in the community is one way to show that we care about our community, but that we also employ our community. Employment is often what we consider a access to greater health. And what we mean by that is employment offers benefits, employment offers financial resources, employment offers, as I mentioned earlier, education. And so whatever we can do to support our communities, we know that if we partner and collaborate effectively and efficiently, then our communities are there's that institutional trust. And so they trust us to be a healthcare provider, but they trust us to be a great employer in the community.
Wow. Well, I know we didn't discuss this previously, and this is to both of you, Miranda and Christina. Um, I know that there are underserved communities in and around Houston, and it can be difficult to reach those communities in order to, both let them know that there are these type of opportunities in healthcare. I wonder if you have any thoughts about the role that community partnerships play in making workforce development really accessible to communities that might be hard to reach. Christina, I see you
Sure, I
nodding.
can absolutely
Yeah.
speak to that. So, as a college, we form partnerships with community-based organizations, right? Otherwise termed CBOs. And with that being said, that is their niche, right? They go in to the churches, the homeless shelters, you name it, they're there. They're in the community that they serve. And, I'll say Harris Health was a prime example of this partnership. They had a specific area that they wanted to really bring talent from. These individuals would have never had an opportunity otherwise. And so we really partner with those organizations because they're in the communities, and we work with them in tandem. So we go out on joint presentations, and because they can speak the language, so to speak, of that community, those individuals are much more committed to the program. They're much more invested in the program. And, it makes a huge difference when we look at demographics, when we look at, the individuals, once again, that they're pulling from those areas.
Wow.
And if I might add to that, um, I think also tapping into the high school programs. Texas Education Agency has done a fantastic job of creating programs of study that are very, very specifically aligned to certain fields so that you capture kids that are interested in these areas, but may not, I mean, they might be in a healthcare program of study, but might not know what an endoscopy tech is, or they might not know the full reach of them. So tapping into those programs, because I mean, they're all in high school. You can catch kids. That's the best time to catch them before they are out in the world and, know what opportunities are available to them. And I know that HCC does a great job of that. We also have opportunities for students at MD Anderson. We have summer programs where they can actually earn a stipend while going to these summer programs. They are focused toward underserved communities. So, and that's a great way for them to kind of get a snapshot into the field of healthcare and know what's out there as well.
Wow. Well, Miranda and Christina, I had no doubt that you guys would have a holistic perspective, but so valuable and valid and detailed. Thank you. So now we've reached segment 2, and this is the point where we look to the future with actionable insights and approaches in healthcare to assemble a vision for what's to come. And I think the implications of the perspectives that you've both shared are actually very actionable. So we're already there. But Miranda, I want to start with you. We've touched on retention and burnout, but it's such an important factor in healthcare workforce development. I know retention is as critical as recruitment. And I've heard that 61% of nurses who leave cite burnout as a factor. So can you tell us a little bit about innovative approaches, either yours or others you admire, and your vision for perhaps even redesigning roles and career pathways or workplace culture to create more sustainable healthcare careers?
I could actually speak to that because at MD Anderson, that is a huge focus. So recently, January, MD Anderson created a wellness institute in which this is a complete focus. It is on employee wellness. It's on reducing burnout for clinicians and for all employees at all levels within the institution. Because you're right, every um, every employee retained is one you don't have to recruit. So that is the goal, and we do have good retention, and this is Dr. Pisters, our president, really focuses on addressing employee burnout and on creating a culture of psychological safety. It is something that we talk about a lot at MD Anderson, and we should. Really, all workplaces should, because if you have a psychologically safe workplace, people are much less likely to leave. So we have we have a wellness institute that focuses on all aspects of employee health and employee wellness, and there are so many benefits that are available to employees at MD Anderson, from mentoring to guidance for the finances to nutrition, to just wellness, all aspects of wellness, to create a like you said, in a holistic way, employees that are well are more likely to want to stay here and thrive in their positions as well.
Not only healing the healers, but keeping them well before it gets to be a problem, right?
Yes, it's proactive. It is incredibly proactive.
Uh, well, Christina, at Houston City College, you're at the nexus of education to employment. What do you think are the most important partnerships or initiatives that need to be developed or expanded in the next 12 to 18 months for Houston City College to generate more of these inclusive healthcare workforce pathways?
Sure. I think Miranda touched on this, but integrating with our ISDs, if you look across ISDs right now, all of them are trying to leverage their continuing education pathways or CTE pathways to figure out how can we take, for example, a CNA or certified medical assistant. Maybe they're already offering that, but they're not offering it in a full pathway to somewhere, right? So our goal would be to embed our pre-apprenticeship opportunities, expand these high school programs so that they include not just their current CTE pathways, but making sure that they're actually earning credentials while they're in school, right? Because then we can take those individuals and we can pathway them into employers directly and get them higher level opportunities, everything from higher wages to 401k benefits, you name it. In addition to that, I think, and I literally had this conversation with some healthcare leaders this morning, we have to think about more pathways. Everybody's doing CNA, patient care tech, maybe medical assistant, but there are so many other roles across hospital systems. So when we look at hospitals, we're looking at them completely. And that's just not your health roles, right? As hospitals continue to expand, they need everything from maintenance techs to IT and AI support, right? So while we have a huge shortage in healthcare, it's not just in those direct healthcare roles, right?
Right.
So we look to really expand digital health through our AI programs that we have. That the telehealth perspective, that's a huge upcoming area. And then obviously just make apprenticeship degree or the earn while you learn model be, hey, it's okay to not go your standard 4-year pathway. You can go the apprenticeship route, or you can go the college route, and that's okay. That's an acceptable pathway to change. Not only do we mitigate the debt that these individuals are going to have, but with our healthcare partners, I think now you're seeing more and more employers say, yes, we want to partner with you in reducing debt. We want to partner with you in helping to support these individuals, whether it's grant funding, tuition reimbursement, whatever it is. Our goal is to upskill these individuals and keep them here long term. So I think as we can once again present these models to healthcare systems and get them all to agree that, yes, this is a fantastic pathway to retain talent, that would be one of our big goals.
Wow, Christina, you mentioned something I just want to double click on, AI programs. Such a hot
Mhm.
topic today and kind of buzzy, but I know with anything that you deal with, it's very practical and pragmatic. Can you tell us a little bit more about how Houston City College is approaching AI programs and if they're specifically tailored to healthcare?
Absolutely. So glad you asked that question. We actually have one of the first bachelor's degrees in AI and robotics in the country. And so we're 100% in on AI. So if you look at hospital systems right now, they're going to be AI driven. Like that is what's going to happen as we have a greater population that needs support already. You see everything from charting, just speaking in AI, taking those notes, right? There's so many different ways where AI can be integrated. And so we need individuals that understand how to leverage AI, but more importantly, how to come into hospital systems and say, hey, how can we make our processes more streamlined? How can we be more efficient? What are things that we can do that can be AI driven and take some of that off of our direct healthcare professionals? So we are 100% in, already working on this initiative.
Wow. And Miranda, I know you and I haven't talked about this previously, but MD Anderson Cancer Center, globally renowned cancer center. Is AI playing a big role in conversations you guys are having over there?
It is entering into all conversations now, how it's being integrated. I think it's, there are considerations that you have to make in healthcare because, AI is not infallible. And so I think we're looking at how that fits into the picture without error and without removing human judgment and also maintaining all ethical requirements that are part of the healthcare environment. But yes, we have a lot of conversations about that pretty constantly and training right now. I think in a year, it will look so very different. I mean, it's moving so fast.
That's fabulous. In the next 12 to 18 months, generating more of these inclusive healthcare workforce pathways is so critical. Jobi, from your perspective at Harris Health System, looking at the broader Houston healthcare ecosystem, how can we better leverage the collective resources of multiple institutions to create a more integrated and inclusive, regionally relevant approach to healthcare workforce development?
So, as you know, or you may not know, we have what's called the Medical Center, and we're part of that. Houston or the U.S. is, I guess, what we could call the largest medical center in the nation. One of the great relationships we currently have in the medical center with other hospitals is that our students are constantly employed by other institutions. So we have to fight to keep our students. And what I mean by students are residents, or nurses, or physicians, or even other employees outside of those sort of care or provider roles. We are very competitive in our training. We are very competitive in what we provide our employees. But it's also, again, because we work with vulnerable populations, we have some individuals that come through our system that have to be highly knowledgeable, highly skilled, and able to be flexible, but also inclusive, right? Understanding what our patients' needs are. And for that reason, it's hard to maintain our employees. But we also know what we're giving back to the community. We're giving our medical center students that have trained at the forefront, at the front lines, other employees as well that have a unique perspective on all sorts of unique patient needs. And I think that that's part of the innovation is that our students go out to other areas, other hospitals, other systems. They're able to contribute their knowledge. They're able to contribute, because we are in some ways a bit of a we don't always have all the resources that some of our other hospitals or care systems do. That innovation in patient care is sometimes there because we have to identify what we can do with the resources that we have. But we've become great partners across the medical center. Part of that collaboration came when COVID-19 hit Harris County. I think that was the first time, if I remember correctly, that our hospitals decided to come together and have a collaborative conversation about what resources, how we can support each other, what kind of innovative care we can provide. And we still do that in the employment space because, as you know, healthcare faces its own sort of employee shortages, workforce shortages, and they only look to get bigger in the future. And so by having conversations, sharing information, and just having that collaborative spirit, I think is part of the innovation that the medical center is highly recognized for.
I want to begin a quick lightning round since we're on time right now. For other healthcare systems watching this conversation, what advice would you give about building effective partnerships with educational institutions, including key success factors? Miranda, let's start with you.
I think it is, for us, it has been important to find educational partners that are kind of already geared up for this. So, working with HCC, they have a fantastic, their apprenticeship hub was already built. You know, there's so many moving pieces in a healthcare center. Like the healthcare employees can't figure all that out. You have to have a educational partner that'll help figure that end out for you. And, the great thing about HCC has been anything we ask for, they've helped us to make it happen. I think what is it? Christina has a saying, if you think it, we can ink it, which I love. And it's so true. Like, if you have a partner like that and I'm going to use patient escort as an example because that's a very recent example. Like that's a big need for us. We have a huge turnover there. And I had someone reach out to me that from culinary, because we have a culinary pathway with HCC, and she was like, "What about patient escort? What can we do with that?" Immediately reached out to Christina. Hey, she's putting together an educational pathway for that. Like they're doing a continuing educational program to meet that need. We have worked with, we've brought in my contact at MD Anderson to weigh in on the courses that are being included in that. I mean, it is completely collaborative, but that is a great example of education responding to the evolving needs of the workplace to help meet those needs. They will recruit the students. That won't be on us. They will put the students in those programs. So that's a fantastic partnership when you can kind of rely on your educational partner as your pipeline and um, they're doing the educating, they're building the curriculum, they're just asking for input on what's needed. And if you have partners like that, it is truly seamless. And I know not all educational partners are created equal. We've been truly lucky to have that in our backyard.
Well, Christina, I know that in talking with other partners of Houston City College, the perspective that Miranda shared seems to be commonly shared about how innovative and comprehensive the work you do there is. Can you give us a perspective kind of in reverse about like your philosophy and approach to building effective partnerships with healthcare institutions?
Absolutely. So I believe the employers are in the driver's seat. We're there to guide them, right? So at the end of the day, who do you want to hire? What skills do they need? And how long do you want them to be there, right? And if we want them to be there longer, then we need to build a pathway that's going to take a longer time frame to get done, because then they feel integrated into the system. But it really starts with the employer. I think as well, it starts with, chief nursing officers that are open and willing to say, hey, yes, let's try this. And it's okay. We're open to mentoring individuals because these individuals, we have a different kind of generation today. They need maybe a little more feedback than maybe in the past. It's not just a throw them in, sink or swim situation. I know growing up, we just got thrown in and you had to just figure it out. It's a little different these days. So, I think having employers that want to innovate with us is key. And we know it's not going to be perfect the first time, right? And we have to work through those kinks, through those bugs, as mentors are learning, as leadership is learning, as students are learning. And so we have to set the expectation that we know up front we'd like everything to be perfect, but our pilot probably won't be, right? But really having those partners that are honest and transparent. And I say, tell me what kind of person you want working for example, MD Anderson, right? Because those are the kinds of people that we want to make sure we can provide you. At the end of the day, the employer is going to interview them. The employer is going to make the selection. But if students say, hey, if I come to HCC, I know I have a huge opportunity of getting placed with Harris or MD Anderson or Memorial Hermann or Texas Children's, then they're going to be more excited to stay in class and be successful, right? So that's where really what I see is having employer partners that are innovative. And then you have to have a leadership team on the college side that is open to, reframing curriculum or reframing the thought, saying, you know what, we thought this is what you were going to need, but clearly based on what you're telling us, it's not what you need. And so, we love our faculty, but sometimes they're not always on the job, right? So that employer feedback is so crucial to making it a successful program.
Jobi, what about you? What advice would you give about building effective partnerships between educational institutions and healthcare institutions, including key success factors?
So, having spent about 20 years in higher education, I think it's understanding the role that colleges and universities play in preparing a workforce. I think too often we have the greatest expectations that students are ready to enter the workforce. And oftentimes they do. I think there was research one time that I read that it said that they lack communication and also team working skills. And so I think it's important to foster relationships to be able to work on maybe where those gaps might be for employment, so that when they do enter the workforce, they're ready to enter that workforce, whatever that bridge may be. But I think that's probably the one sort of takeaway is understanding how ready are their students for the workforce and identifying institutions like Harris Health, a healthcare system that can say, we can help with that bridge, we can help with that training, we can help with those pathways. And I think it's recognizing and having that conversation that creates a better workforce.
So, Jobi, what do you think our audience ought to pay attention to for their own workforce development?
Well, I think as I mentioned earlier, there's a healthcare shortage that we're embracing now, and it doesn't look to get any easier as we continue to go forward. But we have Texas has a statewide initiative to help address some of these healthcare workforce shortages across the nation. I think that there's some opportunities that we can also take a look at, but it really does rely on our community partnerships. We have, again, as I mentioned, great community alliances, and just listening to them helps us identify what is needed. As I mentioned at the beginning of our conversation, information is the greatest resource. And so we've just started a series where some of our physicians are going out to communities to talk about, preventative medicine, preventative care. What are the greatest health issues for those communities, for Harris County, and how can communities work together to assist each other. So it's not all just about the healthcare system. It's about the community and how the community support each other, especially in spaces where either a hospital isn't too readily available or even food isn't too readily available. What are the resources that we all have something to put forward? So how can we pull all of that together to create a really great ecosystem of care? And I think that's where the innovation and that's where we are headed as Harris Health.
The second and final part of our lightning round, Houston is positioned as a national model for healthcare workforce development. I would say a global model, but I know within the U.S., certainly. Looking ahead, what specific actions or initiatives are underway, either in Houston or nationally, that you believe our audiences should pay special attention to for their own workforce development that you're excited about? Miranda, let's come back to you.
We do have a TMC collaborative, Texas Medical Center collaborative, that has members of all these institutions that come together and share what the needs are, which is important because if it's an area we're struggling with, it's an area somebody else is struggling with. So it's important to be able to share and learn lessons from each other and create initiatives. But there's a lot of things going, like the Greater Houston Partnership. There's a lot of Houston areas that are like um, workforce groups that are bringing people together, not just from healthcare, but from other areas within Houston to help for these initiatives as well. And I think that's something that Houston is doing really well. I know that Christina might speak more to the Houston area partnership. She's been a part of that longer than I have.
Sure. So we've been working, Greater Houston Partnership is a massive partner here in Houston. They bring employers together from all areas. I'm actually on the healthcare committee where we're trying to identify healthcare pathways that are going to be the most effective for hospital systems. So this is very timely. But more importantly, they're working on what's called the Connectivity Project. And with this project, looking at kids from 8th grade on up, actually all the way down to 6th, potentially, where we're really able to identify and see what are kids interested in. And here in Texas, I'm not sure if you're aware, but students have to select a pathway in 8th grade on what is that pathway they're going into. And I'm always like, how are they going to select in 8th grade and not want to change that? But, that's a state of Texas determination. So with that being said, it's probably more crucial than ever that we're exposing kids in 6th and 7th grade into what are these pathways, because they get one shot to pick in 8th grade, right? So as they make those decisions, those pathways will be determined. And we want to make sure that they can make intelligent decisions. So with that Connectivity Project, basically it's taking kids from middle school all the way through post-secondary so that we can track them, measure them, and understand what's working, what's not working through this platform.
Well, jaw officially dropped. I did not know about that program in Texas. That's amazing. What is that called again?
Connectivity Project.
Connectivity Project. What a conversation. I learned so much from each of you today. Thank you so much. Some of the best healthcare workforce development minds in the world here. We learned about critical healthcare shortage gaps and how they're manifesting regionally, opportunities for healthcare training programs to evolve to meet today's needs, what more effective work-based learning pathways look like, and innovative approaches to addressing the burnout that affects a majority of departing nurses. Christina shared the most important partnerships that will need to be developed or expanded in the next 12 to 18 months. And, Miranda shared perspectives, and both Christina and Miranda shared perspectives on how to better leverage collective resources of multiple institutions. And they provided advice on building effective partnerships between post-secondary and employers, and the innovative initiatives that are underway at the world's largest medical center and in Texas that you need to pay attention to for your own work. So as much as I would enjoy continuing the conversation with our speakers, this is all the time we have for today. So on behalf of our audience, Job Ready Podcast, and our team at EFA, thank you to our distinguished visionary and change-making speakers, Christina, Miranda, Jobi. It has been my distinct pleasure and honor to work with you all today. To all of you in our audience, whether you contribute to workforce via HR, talent, higher education, community leadership, workforce development, or economic development, gratitude and respect for tuning in to Reimagining Healthcare Talent, a collaborative blueprint for Houston's medical future. Allow me to humbly offer the ideas and information discussed today as concrete belief in and support for your own crucial work. Once again, Miranda, thank you for joining us.
Thank you.
Christina, thank you for joining us.
Thank you so much.
Jobi, thank you for joining us today.
Thank you, Jeff, and thank you for the opportunity. I've enjoyed the conversation as well.
And to our audience, remember, workforce development is the work of not only your lifetime, but generations of lifetimes. Thank you, and be well.